This is Athena Jezik, and we're working really hard to give you some different information because it's so limiting as far as working on bodies. There's only so much you can do. So I'm trying to pull some stuff out of things that I've discovered over the years of practice to be able to share with you. And I got to thinking that there's a big muscle called the pectoralis muscle that attaches, and it runs along the whole rib cage, really, attaches into the arm, and of course up under the clavicle and down through the sternum. And of course this muscle on both men and women as a general rule is not paid much attention to. Maybe just the edges of it are, and obviously because of anatomical reasons you can understand why they're not usually, the pectoralis muscle is avoided. One is that there's a lot of areas on both men and women that tend to be a little erogenous, and when that occurs, that's something that therapists don't usually try to get into that space because it's distracting for the relaxation process, and it starts things going in the body that you maybe don't want, those particular hormones, if you're dealing with having to sedate the nervous system and let people come down and relax and turn off hormones and stressors and things like that. So there's considerations to all of that, that if you are a professional person working in more of a medical vein, you do want to pay attention to that. So I thought I would just show you what I would do if there was some problems in that pectoralis area, and how I do work that on a woman. A man, of course, would not have to be covered. So, and women as a general rule, some of them are okay being uncovered and some of them really aren't. So it's good to learn your skill either way. Now what I'm going to do here is just go around this and then coming down through the clavicular area. Or excuse me, down now along the sternum. I was along the clavicular attachment and now right along the sternum. The sternum is a little band of a bone right here with tendons attaching this to. So I'm just doing little circular motions here now and down to the end. Now at the bottom of the rib cage there's a little bone. It's the xiphoid, and it's a little bit of a floater in a way. It is attached, but one thing you want to be very careful of is that you don't push on it very hard. That is not something that you want to do. So when you're coming down, you get to the end of the sternum, just stop where the bone is nice and strong, where the ribs kind of come to that point. Just avoid that area, and then you can work the pec down into the ribs, which is underneath this area. Now I'm right along the ribs. In fact, I'm between a couple of ribs here, and now I'm crossing over some of the other ribs to get into that area. Now you can also use the muscles, work the muscle a little bit differently. So let me show you as best I can what you might do in a situation. Usually it's fine to pull things up and make it very massage therapist finger friendly, to get as much out there as possible and still being respectful and allowing a little modesty to the client or patient on the table. So I'm going at both directions here and paying attention that this does attach into the very upper arm. I'm working a little bit into the edge of the deltoid. So now when I do this, I can come into the clavicle, under the clavicle and into the sternum, and just